There is one thing stronger than all the armies in the world put together, and that is an idea whose time has come. Idea perhaps is the most dangerous and most powerful of all the weapons. Hello and a very warm welcome, viewers. You're watching the special presentation of Sansad TV on the journey of startups. India has the third largest startup ecosystem in the world. And if you're an aspiring entrepreneur or even otherwise, this is your destination as we script the novel success stories of startups, analyze the roadblocks and give wings to your dreams of becoming a job giver and not being a job seeker. So today, let's hear the story of healthcare startup EONMED and founders Harshvardhan and Ramaraman. EONMED is a healthcare technology company that easily connects doctors with the patients. EONMED DOCQR is the quickest and simplest way to connect with the doctors. One just has to scan the DOCQR and connect with the doctor right away. It has a particular feature of reminding people about their medicine and vital measurements as per the prescription. This is a 40 square feet state-of-the-art digital healthcare cabin where people can do video sessions with the doctor, check all their vitals including ECG. This clinic also has a digital stethoscope by which a doctor can check the patient's lungs and heart in real time with the help of a nurse. All right, Ramaramanji, Harshvardhanji, welcome to Sansad TV and thank you so much for joining us. Now, India's first smart clinic.
Yes.
Aapda Mein Afsar is what Prime Minister has been talking about since the onslaught of the pandemic, where we've been talking about being Atmanirbhar. When the pandemic struck in 2020, August 2020, you had this startup. Tell me, how did the journey begin?
When the COVID arrived, we had so many issues. COVID testing was one of the major issues where we were unable to track like how many tests are taking place. There were so many fake reports, and also we created a methodology like how we can do the mass COVID testing so that no one is able to create a fake certificate. So we created an QR code which will be present in all the COVID testing kit, and our kit becomes smarter with that technology. So after that, after making that methodology, we started working in creating the COVID testing kit, and we launched the India's first saliva-based COVID testing kit.
All right, India's first saliva-based COVID testing kit. Now, I've had the horrendous experience of getting that test done through the nose, through the throat. This saliva test,
Yes.
I'm sure it became very popular very quickly.
Yes and no. There are multiple factors that came across to us, like approval from ICMR. We got a very delayed approval, but that also didn't make a very big impact in our sales. We did a good number of sales, and as you said, it was very scary to basically go and get tested for COVID.
Yes.
And that's why most of the people avoided to test. And if for us, for you and me, still it is very okay. But a pregnant lady, a senior citizen, a person with a, let's say, has a nose injury, or a person or a kid, it is a scar that will basically be with them forever.
Very painful. Very painful. Yes.
So we have a good fortune that we have a good scientists with us. We basically co-developed saliva-based COVID testing kit with them. We sold those kits. But as you have already said, Aapda Mein Afsar, as we sold the kits, we started getting calls from the patient, see, I have a fever. What should I do? Do you have any doctor? We never thought that we would be pivoting to telemedicine. But when the calls started coming, we thought we need to basically address these problems. So we started a telemedicine service where we empaneled 20-25 doctors. They were suggesting medicines to the patient at that time. And basically our USP at that time was to provide a doctor in 2 minutes. Even though nowadays there are government websites, government infrastructure that are providing telemedicine, private infrastructures, but getting to a doctor is a hurdle.
Yes.
You cannot get to a doctor or general physician in less than 5 to 10 minutes, and that too you'll have to pay first. You will have a booking of the appointment, then you get to a doctor. I have a stomach ache. I don't want to wait for 15-20 minutes. So that's why we developed a simple methodology. Just click on the app, go on the website, enter your phone number, and you are connected to a doctor.
So what happens? Let me understand this. So I click on an app.
Yeah, or you can open a web browser basically. You just have to enter your mobile number and your name, and you have to click on call the doctor, and you'll get a doctor within a minute.
Within a minute, that's for
within-
sure.
Yeah, you
And
don't
we are-
even have to make a payment. You have to make the payment after taking the doctor consultation.
Okay.
You are in a problem, and we don't want to basically push you, say, hey, make a payment first. No, you just consult with a doctor.
You need
Get
a doctor.
satisfied.
You need a doctor. You get a doctor.
Yes.
And what if after the consultation I do not pay the price?
We trust people. People don't do this.
Okay. Okay, so smart clinic, let's talk about that. Where did that idea come from?
Okay. So, as I said, when we started scaling telemedicine, when the calls started coming from rural areas, there was a gap which was clearly visible to us. If I'm sitting in a distant village of Bihar, I don't get very satisfied from just calling and talking to a doctor on a video call.
That's right.
In rural India, people are still looking for the touch and feel of a doctor. But 80% of the doctors are sitting in metro cities.
Yeah.
And you cannot force them to go and start practicing in Balia or in Gaya. It's their choice.
Exactly.
But there is a need.
Yeah.
This is a big demand and supply gap. And just promoting telemedicine on video call is never going to be a solution. You will have to be there in the village physically and then provide telemedicine.
So, but Harshvardhan ji, that problem remains. The doctors do not want to go to the remote areas. Then how do you manage that?
Our doctor doesn't go to a rural area or rural community, but we can telemedicine can easily reach there with the help of technology. So we have created a smart clinic where a patient have to enter the smart clinic and he can start a doctor consultation, which will be assisted by the physical nurse present over there. So basically you have to take a doctor consultation inside the clinic, and there are some instrument which we are providing over there, like digital stethoscope, where doctor can hear your live heart sound and lung sounds. So like a physical doctor used to do, like he hears your sound, he hears your like heart rate and everything. There are machines over there for monitoring BP, sugar. There is an ECG machine. So all those vitals a doctor can easily get sitting in a metro city.
Okay.
And the nurse physically over there is going to provide the medical health which the patient needs.
Oh, fantastic. But tell me, both of you have been engineers.
Yes.
Both of you were working as well. What triggered you to quit your cushy jobs and take up this business?
See, first of all, when COVID was present, it was very scary, as well as it scattered the complete infrastructure. Big companies, big IT companies, big medical companies, they were clueless. But we knew India need a pandemic management solution. And I pray to God this doesn't come again. But what if it comes again?
Yeah.
Are we ready? So technology is the only way that can actually support the government to basically handle such structures. If you can see the COVID, it was majorly a supply and demand gap. May it be oxygen cylinders, may it be the medicines, may it be the doctor consultation. We were not able to provide exact supply to exact demand. And this can never be done on pen and paper. You need an actual robust technical infrastructure. And that basically came in our mind, and we thought, let's create something like that. And then everything was destined, we can say.
So the engineer inside you started prodding you.
Yes.
Yes.
All right, let's talk about the business model. So healthcare stream is a very expansive stream with a lot of facilities, with a lot of tech interventions. How did you think of this business model?
We don't always need to re-engineer things. Or there are already government infrastructures, private infrastructures that are present in right now, in these days. For example, let's say ASHA workers. There are number of ASHA workers present in the rural areas. they know the basic medication or nursing activities. What if we train them for telemedicine? What if we equip them for telemedicine? Can you imagine? For example, let me put a number with you. Can you guess how many OPD consultation happened last year? Any number? It was 400 crore consultations.
Oh my God.
That too only to the registered hospitals. There are clinics which are not registered under
Absolutely.
NHM.
Yes.
There are people, more than the people are going to the hospitals, who are going to the pharmacies. I have a stomachache, give me a medicine. There are humongous number of people like that. And apart from that, there are another set of people. For example, you had a headache. I will ask you, hey, you had a headache. Which medicine did you take? No one is actually asking the doctor.
Yeah. All of us are doctors.
Yes, that is
Yeah.
the problem. And there is two major reasons. First of all, accountability and affordability. I don't know if I'm asking to the doctor or a person in the rural area, is he accountable? First of all. And will it be affordable? To basically ask for a stomachache, if I had to pay 500 rupees, why will I go?
When I can self-medicate.
Yes. So
Yeah.
affordability and accountability is a major issue.
Right.
And when we are talking about ASHA workers, Sanginis, or paramedic staff that are already present in the hospital, the nurses that are coming to Delhi, getting trained and actually working for 5,000-8,000 rupees in big hospitals.
Yes.
So if we equip them, if we train them and let them go to their villages, make them a medical entrepreneurs by their own, this will actually create a major mark in this telemedicine service.
And probably prevent self-medication, because I think that is a very, very difficult situation in our country here where everyone is a doctor.
For example, let me put you a case. I will not name the location and the patient. There was a lady who was taking the medicine for a stomachache for, let's say, 3 or 6 months. She used to go to a pharmacist, she used to take the medicine, and then stomachache was gone. After 6 or 7 months, 8 months, she fainted.
Yeah.
And when she went to a hospital, she was diagnosed with a major worms in her stomach. One of the worm went to the head. She collapsed.
So viewers, this is a very important message on the show of startups here, that self-medication is a big no-no. Now let's talk about the funding part of it. Completely bootstrapped?
Yeah, we are completely bootstrapped.
How did you manage the finances?
We sold good number of kits, first of all. And then people are liking our app. People are basically getting very good, giving us a very good review. We are not spending much money into the marketing, but we are getting good word of mouth marketing as of now. So, and we are a very small team, but with a team with a good number of skilled people, and we are able to manage it.
And you've already started making the profits.
Yes.
We are profitable
Yeah, we are profitable as of right now.
as of right.
So going ahead, what are the plans? What are the future projections?
First of all, our plan is our goal that we have a motto of Sarve Bhavantu Sukhina, Sarve Santu Niramaya. This is the moral goal that we have in our head. And expanding the business through ASHA workers, through villages, basically be present in every village. It may be through CSRs, it may be through government collaboration, it may be through the franchises that we are selling, but we want to be present in every village and at least be a solution for a person who is actually sick and might be looking for a solution.
Yeah, currently we are also launching a clinic in a bag where we are empowering ASHA workers, Sangini workers who are already present in the village with the minimum instruments to do a doctor consultation, to provide telemedicine in the rural communities. So we are making an infrastructure how we can provide like doctor consultation in those areas with the help of the medical professional already present in the rural areas. So basically currently ASHA worker can provide doctor consultation to the patients or to the rural community overall as a whole with the help of our clinic in a bag.
That idea sounds again very interesting, but I'm sure there were many challenges.
Yes.
How did you address all those challenges?
For example, first of all, the biggest challenge was people are not very um, friendly to telemedicine.
Yeah.
So we started providing health camps in these villages. We started providing free testing in these villages. When a person who was never able to talk to a doctor for 30 seconds, if I talk about a rural person, a villager, if he is going to a hospital or a nursing home of substandard, even there he is not addressed by a doctor for 30 seconds. But that person smiles when he comes to a smart clinic. Doctor is giving him a complete 2-3 minutes of time, 5 minutes of time, listening all his problems. This is what we want to make. People should be comfortable in speaking in front of a doctor. No doctor should not be very much. See, doctors have their own problems. We
Yes.
completely understand that. But this is not their individual problem. We have to create a culture where even a person who cannot afford the particular medications can talk to a doctor. And मुझे याद है, my mom used to say कि आधी बीमारी तो डॉक्टर को देख के ही चली जाती है.
बिल्कुल ठीक बात है, बिल्कुल ठीक
Yeah.
बात. Let's also talk about the money part of it. So if I go on the app and get a consultation from the doctor, how much do I need to pay?
149.
That's it?
Yes.
And what are the illnesses and diseases that you cover?
All the primary healthcare problems we cover.
See, primary healthcare covers most of the things, which I can say from dengue, malaria, stomachache, headache, nausea, cold, anything that you can think of, other than surgeries or other than a grade 3 or grade 2 level of problems. Let's say if you have a skin issue, skin rashes, it can be covered under primary healthcare. But if the grade of skin infection is bigger, my doctor will ask you to go to a specialist, which is a physical doctor, because we have to understand that there are problems which cannot be dealt with the telemedicine.
Right.
So with the EONMED, our main goal is to basically lower the load of the hospitals. Right now, for example, AIMS Patna has a OPD of 4,000, 5,000 people. And out of 4,000, 5,000 people, 80% doesn't need to basically come to a doctor.
Yeah, right.
And because of this, the person who is actually in need of a specialist is not able to get it.
So you want to reduce the healthcare burden. That is a very important part. But before we end this conversation, I want the message from the two of you as engineers who quit their jobs to take up this venture. What is your message to the other budding entrepreneurs?
See the problems.
Identify the problems and get the solutions and then make your money.
Yes.
Making money is always secondary. You will have to make an impact. If you are making an impact, then money will come.
Money is a byproduct.
Money is a
basically.
byproduct. You will have to be in ground, first of all. And secondly, don't get influenced. Never
Influenced
get
by what?
Influenced by the
what?
current environment. People are going crazy on the valuations, on the funding. This all is secondary. Just work. Work on the ground. Everything will come itself.
Harshvardhanji, your message for the budding entrepreneurs.
Don't lose hope. There is always a light at the end of the tunnel. We started working. It took us one year and 6 months to be profitable. So, one has to keep working hard.
But that's also very quick, 1 year and 6 months to become profitable.
Yes.
That's not bad.
But
We only know how
how
this
hard
1 year
and
and 6
struggling.
months went.
I'm sure.
Yeah.
I'm sure. But fantastic talking to the two of you and all the best for all your efforts.
Thank you.
Thank you.
Well, viewers, that's all I could pack for you in this edition. Thanks for watching and stay tuned to Sansad TV. Goodbye from my side for now.